Today, we're exploring the topic that affects many athletes, fitness enthusiasts, and just about anybody with muscles. I'm talking about tendinosis, a common chronic tendon condition that can be painful, limiting, and frustrating to manage. In this video, we'll explore what tendinosis is, its causes, and the key management concepts to help reduce pain and improve function. A tendon is a tough, fibrous band of tissue that connects muscles to bones, allowing for movement of the bones in the joints. Tendons work in tandem with muscles to generate force and control movement. They are made up of collagen fibers, which provide strength and flexibility to the structure. Tendons are found throughout the body, from the small tendons in the hands and feet to the larger tendons in the arms, legs, and back. They play a crucial role in our ability to move, and any damage or injury to the tendon can result in pain, limited range of motion, and reduced strength. Tendons are often exposed to a great deal of tension, making them prone to injury. There are two main classifications of tendon injury: tendinitis and tendinosis. The suffix itis implies an acute inflammation of the tendon. The symptoms are typically pain, swelling, and tenderness around the affected tendon, whereas the suffix osis, meaning pathology or disease, implies degeneration and weakening of the tendon. Tendon injuries are typically due to repetitive stress and faulty movement mechanics, and commonly involve tendons that are frequently utilized in those that experience high loads, such as the Achilles, glute, rotator cuff, and elbow tendons. So why the semantics? Well, understanding the type of tendon injury and the underlying pathophysiology is important to guide the treatment approach. This is better appreciated when you take an up-close look at these two types of tendon injuries. Normally, a healthy tendon is white and shiny, which reflects the strands of highly organized protein molecules that make up the type 1 collagen fibers, the most abundant fiber that forms the tendon. When healthy tendons are injured, inflammatory cells rush to the area, resulting in a typical pain and swelling response that characterizes tendinitis. And despite the local tendon injury, the surrounding collagen fiber integrity remains intact. However, when chronically painful tendons are placed under a microscope, there are clear signs of alterations in this fiber arrangement. The tendon looks gray and dull, and the orientation of the collagen fibers are disorganized, irregular, and show signs of disruption. There is also a notable lack of the normal inflammatory cells that you see in tendinitis, which is thought to impact the rate and capacity for healing. These tendons are in a constant state of disrepair and experience an increase in production of type 3 collagen fibers, fibers that are typically seen in the earlier phases of wound healing. Over time, as the tendon is continually subjected to excessive strain, type 3 collagen fibers build up, causing the tendon to thicken. Now, you would think that a thicker tendon means a stronger tendon, but unlike the type 1 collagen fibers, type 3 fibers have significantly less load-bearing capacity. So accumulation of these fibers actually results in a much weaker tendon that is susceptible to further load failure and injury. If this cycle of tissue breakdown is not interrupted, the tendon can become so weak that complete tendon tearing occurs, which may require surgery to correct. So unlike tendinitis, which can be effectively treated with rest, medications to reduce inflammation, and gradual return to activity, tendinosis requires a bit more TLC to manage. The most important aspect of treating tendinosis is load management. If the tendon continues to be constantly overloaded, it will remain painful and run the risk of further breakdown and worsening of symptoms. So the first step is identifying activities that place increased tensile and compressive forces through the tendon to minimize further injury. This, of course, is dependent on the type of tendon, but as a general rule, any activity that causes more than mild discomfort or results in pain lasting for more than 24 hours should be avoided. Reducing the number of times an activity is performed, reducing the weight of the activity, or modifying the specific task that causes irritation can be effective strategies to promote activity while at the same time minimizing tissue irritation. For athletes concerned about staying in shape, a common strategy utilized in the load management phase to promote or maintain conditioning is cross-training. This involves performing other exercises that minimize stress through the healing tendon, but allows individuals to maintain the conditioning and strength in surrounding muscles. So instead of running, you could cycle or swim. Due to the negative effects that immobilization can have on tendon and joint health, complete immobilization strategies utilizing slings, walking boots, and splints should only be utilized in the most severe of cases, or in situations when activity modification is not possible so that symptoms can settle down. While managing the load through the tendon, it is still important to stimulate the healing process of the tendinous tissue, but not in a manner that is going to overstrain it. Research has shown that prolonged disuse results in reduction in size and strength of the tendon, which can compound issues. So preventing deconditioning is important in this phase. A classic method of controlled loading in the painful phase of tendon rehab is utilizing isometrics. An isometric contraction is a static contraction of the muscle without any visible movement in the angle of the joint. Studies have shown that isometric exercises not only prevent deconditioning of the healing tendon, but has also been shown to enhance muscle contraction while also having a pain relieving effect. It is suggested that isometric exercises be performed in the mid-range of muscles motion to avoid overstretching or compressing the tendon. A prescribed exercise dosage of 4 sets holding for 45 to 60 seconds with a 2-minute rest time in between has been shown to have positive effects. Patients are instructed to perform these exercises 4 times a day, pushing at roughly 70% max voluntary contraction, or less if too painful. Although commonly prescribed, it is not advisable to stretch a tendon that is highly painful due to the risk of compressing the irritated tissue. If muscle mobility is an issue, it's better to stick with techniques such as massage, dry needling, or foam rolling to reduce muscle spasms. Joint mobilization and manipulation is another way to enhance movement around the surrounding joints and soft tissue while also providing pain relief. The interventions discussed so far focus on reducing pain. While these treatments may provide temporary relief, they do not address the most important underlying cause of tendinosis. Despite feeling better, everything up to this point has been for nothing if treatment stops or is not progressed. Now that pain is controlled, the tendon needs to be loaded. Loading provides the stimulus required to promote the production of the strong type 1 collagen fibers to replace the weaker type 3 fibers. But unfortunately, this process takes time. How much time, you ask? Well, it takes up to 3 months of consistent loading to see any signs of changes in type 1 collagen production. It takes up to 6 months to finally see notable changes in tendon tissue quality. Unfortunately, there is no way to accelerate this process, no matter what creams, braces, or fancy treatments you use. An evidence-based way of promoting adequate tendon loading is through heavy, slow resistance exercise. As mentioned, to create change in the structural properties of the tendon, loading must be applied to the tendon to cause sufficient strain. Now, there are 2 important parameters that should be considered when loading chronic tendon conditions. Number 1 is the intensity of the exercise. Research suggests that the tendon should be loaded at or above 70% of a person's 1 rep maximum. Anything less falls below the necessary strain that is required to promote tissue adaptation. Now, because of the risk of injury with performing a 1 rep maximum, I would advise instead finding your 5 rep maximum. This means finding the heaviest weight that you can lift with good form for 5 repetitions. I provided a link in the description to a website that is helpful to calculate your 1 rep maximum. The second parameter is the rate of loading. Performing exercise at a slow pace increases the amount of time the muscle is under tension, ensuring the tendon is exposed to the applied load for a sufficient period. If the exercise is performed too rapidly, the elastic properties of the tendon will take over, reducing the overall tissue strain, resulting in less adaptive loading. It is suggested that exercises be performed at a rate of 6 seconds per repetition. A metronome can be helpful to keep the pace of the exercise. See this link in the description as well. Heavy, slow resistance protocols frequently utilize 3 to 4 sets starting at 15 repetitions and progressing in weight with a reduction in repetitions over time. Throughout this process, it is important to monitor for signs of tissue overloading by tracking pain intensity and duration of recovery. Pain during exercise is acceptable if it is mild to moderate and resolves within 24 hours. It is advisable to provide sufficient rest breaks up to 2 minutes between sets, especially earlier on to promote adequate recovery, as these muscles and tendons are not yet sufficiently conditioned. Research suggests that those with tendinosis perform a heavy, slow resistance program 2 to 3 times per week, which has been shown to help with patient compliance compared to other methods which require daily exercise. For athletes or those who need to perform more explosive movements, a heavy slow resistance program paired with a plyometric program is advisable to develop both strength and power. To recap, tendinosis treatment can take months to see significant benefits, which can lead to frustration for both the patient and provider, especially if this condition is not understood. Successful management often requires a long-term commitment to rehabilitation to promote changes in structural integrity of the tendon, making patient compliance critical. Many treatment options for tendon conditions focus on reducing pain, and while these treatments may provide temporary relief, they do not address the underlying cause of tendinosis. Adequate loading is key to provide the necessary stimulation to induce tissue adaptation. In addition to heavy slow resistance training, individuals with chronic tendon pain should modify their activities as needed to minimize overloading, which can slow recovery and even lead to worsening of symptoms. If you're struggling with tendinosis, it's important to seek advice from a physical therapist to get a proper diagnosis and develop a personalized treatment plan. Remember that managing chronic tendon pain can be lengthy and requires patience and consistency. But with the right approach and dedication, it is possible to achieve significant improvements in symptoms and function. Thanks for watching another episode of Physio Show. Make sure you like and subscribe to the channel to receive more physical therapy related content.